So when you have your baby, if the baby is a boy, one of the big questions that you need to figure out is whether or not you want to have your baby circumcised. And believe me, this is a very, very controversial subject. If you want to start a really big fight, just go to any pediatric convention and bring up routine circumcision and just step back and watch people go at it. Or go into any internet forums and do the same thing and amuse yourself. So this is very controversial, and there are people that feel very, very passionately on both sides of the debate. I'm kind of a middle-of-the-road guy, and so let me explain to you the way I see it, the advantages of circumcision, the advantages of not being circumcised, and kind of how I advise my patients on what they should do with their boys. So let's start with circumcision. What is circumcision? The penis has a skin called the foreskin around the end of the penis, and that foreskin retracts down to expose the glands of the penis. Circumcision is removing that foreskin so that the glands of the penis is exposed all the time. It's a very ancient practice. It dates way back to, thousands of years BC, and originally was a religious practice and has broadened and has really broadened along cultural lines. So what are the advantages of circumcision? There are some definite medical advantages to circumcision. Babies that are circumcised are much less likely to get a urinary tract infection in the first year of life. Now, those of you women that have had a UTI, it's not a big deal, but a UTI in a baby is a big deal, and it actually usually requires hospitalization. So there's a 7 times less chance, a 7-fold decreased risk of urinary tract infection in the first year of life in circumcised boys. So that is one definite medical benefit to circumcision. There are also some diseases of the foreskin that obviously can't happen if the foreskin isn't there. Things like phimosis and paraphimosis. There's also issues where the foreskin can get trapped beneath the glands, and that can become an emergency where the foreskin has to be cut so that blood flow can be reestablished to the penis. So that's an issue that can happen later in life as well. Boys that are circumcised or men that are circumcised are much less likely to have HPV or to pass that HPV to their spouses. And so women who have circumcised husbands are much less likely to get cervical cancer than women whose husbands are not circumcised. And that's true with some other STDs as well. Surprisingly, it was found that circumcision was actually very beneficial against transmission of HIV. And there was a huge study that was done in South Africa that showed a very large decreased risk, almost 60% of HIV transmission in circumcised males. And so that actually made big news in the HIV world. And so in countries where there's a very high incidence of HIV, in South Africa, for instance, that's a big difference. In countries where the risk of HIV is very low, even though it's a decreased transmission rate, because the chance of being exposed to that disease is so small, it really doesn't turn out to be a great big number. But there is that medical benefit. There is a very rare type of cancer called penile cancer that is essentially non-existent in men that were circumcised as infants. So that's one cancer that's essentially completely eliminated by circumcision. However, it's a very rare cancer. The lifetime risk of penile cancer is only 1 in 600. So again, there are these medical benefits of circumcision, but the medical benefits aren't huge. But people certainly argue these medical benefits as reason to circumcise newborns. There's a financial argument for circumcising newborns as well, at least in the United States. And statistically speaking, about 10% of boys that are not circumcised as infants will become circumcised later in life for one reason or another. And if you look at the financial costs, it's very easy to circumcise a baby in the newborn period because it's a little office procedure. However, once a baby is more than about a month of age, circumcision becomes a much bigger deal. It needs to be done in the operating room because the blood vessels are bigger, a suture needs to be involved. And so it becomes a much bigger surgery, bigger procedure, and costly. And so if you do a cost-benefit analysis and you take that 10%, it's actually cheaper to circumcise everybody than it is to only circumcise the 10% that will eventually need it for medical reasons. Now, I personally don't think that cost-benefit analysis is the right way to practice medicine, but I'm just giving you some of the arguments that the pro-circumcision people use to justify routine neonatal circumcision. Now, what are the reasons against circumcising babies? The biggest reason that people give is that circumcision is not natural. In other words, we're born with the foreskin, why remove it on everybody? And it can be painful for babies. So also, the baby doesn't have any choice in the matter. And so you're changing the baby's anatomy and the way the baby looks without the baby getting any say-so for reasons that are, in some people's minds, dubious or at least not great. Some people believe that uncircumcised males have more sensitivity in the glands of the penis, and so it changes the sexual experience. It's really hard to tell whether that's true or not, but that is an argument that people make. But mostly, people that are against circumcision on the grounds that you're really altering a baby's genitalia without their consent. And I think that's probably the strongest argument against circumcision. So what's the right answer? Well, something that's as hotly debated, obviously, I'm not going to be able to give you the right answer. The right answer is going to depend on how you feel about it. The advice I give my patients is that I think there are definitely some medical benefits to circumcision. I don't think those medical benefits are huge. So I don't think you're a bad parent if you don't circumcise your baby, but I also don't think you're a bad parent if you do. My advice is you're probably best off making the baby look like everyone else in the family. So if the dad is circumcised, probably easier, life will be easier if you circumcise the baby. If the dad is not circumcised, probably better to keep the baby looking like dad. I mean, if you've got a family where the dad and his 3 brothers are all one way and you make this baby look different, it certainly can cause friction later in life. And so that's my general advice about circumcision. And again, this is a very, very hotly debated topic, and I am certainly not going to try to talk anybody out of one camp or the other, but just to give you an idea of what the arguments are.
Medtwice.com